So Rhiannon, I remember you mentioning that you almost completed your physio degree and that you had some experience working with people with osteoporosis. What was that like?
Yeah, so one of my first ever placements I did for physiotherapy was in women's health, and it was technically it was a maternity ward, but it was also an outpatient clinic. And so I got to see a lot of older women or female identifying people come through with fractures or rehabilitation for that. A lot of it was post-hip replacement because of the fractures with osteoporosis. And we did a lot of, the focuses of the rehabilitation post-surgery or post-fracture, and trying to get them to a functional level to be able to get through their lives after that, for sure.
Yeah. Wow, I can imagine that would have been a very eye-opening experience.
It was.
Now, I've also heard that once someone suffers from a hip fracture as a consequence of osteoporosis, the statistics on that can be pretty damning.
Yeah.
Was it how did you find that?
I found it was, I think after having the knowledge and doing some research into osteoporosis and the statistics surrounding, post-hip replacement surgery or anything like that, that lots of people didn't realize. And so there was a lot of education around it as well. It was a big portion of dealing with the patients that we were seeing. So that was very interesting, and yeah, I learned a lot from it.
I can imagine, and all of those women that you must have been working with, having gone on with and living with this disease without even knowing, and not knowing that it might have been able to have been prevented.
Yeah, that was a very interesting thing. I think even a lot of my friends my age don't know that they can be doing things to prevent it.
Definitely, and I can imagine that would be so confronting for someone. Did you feel like your experience in uni, I think, what was it, 3.5 years doing physio out of 4, do you feel like that prepared you to work with women with osteo? And men, because it affects both.
Look, I think it very much prepared me for rehabilitation of after the fact of having a fracture. I did not, all the information was, gold standard and everything like that, but there was no real information on prevention or the fact that it really even could be prevented. And I actually learned more on the placement, I think the 4 to 5 weeks that I was there, than I did about osteoporosis while I was at uni. And a lot of that was through my own personal research to kind of get more of an understanding of the people that I was seeing on a day-to-day basis. So.
Now, I don't know about you, but in a sense that makes my blood boil a little bit. This disease that, affects so many people, and people aren't even aware. They don't even know that they can prevent that. And it being a silent disease, why aren't people being screened? Why aren't they being tested? Why aren't they being made aware that they can, stop this progression? Because it is a really debilitating, can be, a deadly disease.
Yeah, and why was I, a student physio, there to tell them about this?
Exactly, and why weren't you trained, for something that affects so many people?
Yeah.
And how do you feel about osteo treatment being focused so much on the treatment aspect and not at all on the prevention?
It makes me, it really frustrates me and it upsets me in that, I don't think our attitude should be towards just fixing the result of the problem. And a lot of, I feel like health and medical is, let's treat the outcome, whereas the research shows there's so much we can be doing. It frustrates me that that's not more of a focus.
Yeah, and I completely agree with you, especially, I guess it's really eye-opening when you have such a personal connection. As you're aware, my mum found out that she had osteoporosis earlier in the year, and she has it, unfortunately, in her hips. And it's really, a very confusing time, because what do? We know that, weightlifting, nutrition are such big parts of it, but even the treatment measures are all focused predominantly on medication base, and also until someone has a fracture or a break, they don't get to see an exercise professional. Yeah, exactly. It's ridiculous.
Yeah, I think a lot of the exercise and everything that's preventative is really good, but a lot of the time women are maybe peri or postmenopausal, and a lot of it doesn't take into account pelvic floor issues, or it might not actually take into account their physical activity levels. So there's so much education and work to be done.
Definitely. And so what would you suggest to someone who is susceptible to osteoporosis, or maybe has recently been diagnosed? Would you advise them to seek the help of an exercise professional?
I would definitely recommend potentially, especially if they're a woman or female identifying, seeing a women's health physiotherapist that do a lot more postgraduate study into that area, and there's a lot more information there. I definitely would recommend it. But if you don't have the means, definitely talk to your healthcare professionals. But make sure you're walking and just getting movement into your body, loading your bones, and eating as well as you can, and going from there.
Beautiful. What wonderful advice. And you're right, and I think that's something that's so often overlooked, that osteoporosis, it's also associated with postmenopause, and also like having a hysterectomy and things that people don't consider, that may also make them even more susceptible to other comorbidities. So thanks, Rhiannon.
Anytime. Thanks, Tyler.